Please sign here. And doctor number 3. Please sign here.
SPs, please prepare. Examinees, you may begin your first patient encounter.
Come in. You come in. Hello.
Hi, Mr. Thompson. I'm Dr. Tarim Sultana.
That's nice to meet you.
This is your office today.
Okay.
Nice to meet you too. I'm here to ask you a few questions and do the physical examination. Is it okay with you?
Yeah, sure.
Okay. May I sit down and write while we talk?
Sure.
Okay. Are you comfortable in this room?
Yeah.
So, Mr. Thompson, how can I help you today?
Well, my right knee's been killing me. It's been hurting pretty bad for the last 2 months, and just the last 4 days it's gotten really bad.
Okay.
Yeah.
I'm sorry to hear about that. Okay. And can you tell me more about how you have been experiencing?
Well, I've been training for a triathlon, and about 4 days ago I took a fall and I landed on my knee, and ever since then it's just been really bad.
So that was 2 months ago?
The fall was 4 days ago, but it's been kind of hurting me a little bit for 2 months.
Okay, so
But it got a lot worse 4 days ago.
okay, so you have been running for the marathon.
Yeah, the triathlon. Yeah, I've been training pretty hard for it.
Okay, since how long?
Gosh, probably the last 4 months or so.
Mhm. Okay. Okay, in a range of 1 to 10, 10 being the most severe pain, can you tell me the severity of your pain?
Maybe a 6.
Okay.
Yeah, something like that.
And what kind of pain is it?
It's just kind of an aching pain.
Okay.
Yeah.
Can you point to me exactly where is it?
It's just kind of like in this area right here. I don't really know exactly where.
Okay. Okay. And you said this is progressing, right? And 2 months ago, how did the pain start? Was it sudden in onset or gradual?
Yeah, it just kind of, I just kind of woke up and noticed that my knee kind of hurts a little bit, and it just kind of just lingering on for about 2 months until the last 4 days, and after that fall, it kind of did me in. So.
Okay. So has it been constant pain or comes and goes?
It's pretty constant, yeah.
Okay. And is it something that makes your pain worse?
No.
Is there anything that makes it better?
No, not really.
Okay. Have you had trauma to your knee?
Yeah, just when I fell on it.
4 days ago, right?
Yeah.
Do you feel the pain is moving anywhere or is it?
No, it just stays there.
And you had trauma to this knee or to any other area of the body?
Just this knee, yeah.
Okay. And what kind of trauma was it? Can you explain me how did you fall down?
Well, I was just running and I just tripped on something in the road and I just fell. I just landed right on my knee.
Okay.
Yeah.
So it was direct impact on your knee, right?
Yeah.
Okay. So now may I ask you a few questions about your health in general?
Okay.
do you have any nausea, vomiting?
No.
Do you have any fever?
A little bit, yeah. I've noticed I had a little fever like the last 2 days.
Have you measured your temperature?
Yeah, it was around 100.
Okay.
Yeah.
Okay. And you have pain in any other joints?
No.
Okay. Have you lost or gained any weight in recently?
No.
How's your appetite?
That's good.
Okay. Okay. And do you have any night sweats?
No.
Any chills with your fever?
Mm-hmm.
Do you have any rash anywhere in your body?
No.
Okay. Have you had any ill contacts recently?
No.
Okay. May I ask you a few questions about your past medical history?
Yeah, sure.
Okay. Have you had any similar complaints in the past?
For my knee, no.
And were you diagnosed with any medical condition in the past?
Well, about 2 months ago, I got diagnosed with gonorrhea, but I got it treated, and I don't have that anymore. And
Okay.
if it matters, maybe like 6 months ago, my big toe kind of just got swollen, but it went away, so it feels fine now.
Okay. So are you taking any medications for these things now or?
No,
you're
not
with
anymore.
them?
Yeah.
Okay. Are you allergic to any medication?
Just penicillin.
And what kind of allergy do you have with it?
Just rash. Yeah.
Okay. And may I ask you a few personal questions? I want to assure you whatever we discuss is going to be completely confidential, okay?
Okay.
And do you use any tobacco products?
No, I don't smoke.
Do you drink alcohol?
Yeah, I drink a little bit, like, I don't know, maybe 2 beers a day.
Okay.
Yeah.
And do you use any illicit drugs?
No.
Okay. Are you sexually active?
Yeah.
With whom?
It's a couple girls.
Okay. Is it only girls or even men?
Just girls, just
Okay.
girls.
And do you use contraception?
No.
Okay. Have you ever been, apart from the gonorrhea 2 months ago, previously have you ever been diagnosed with any sexually transmitted disease?
No, not before that.
Okay. Have you ever been tested for HIV?
No.
Okay.
Do you think I have HIV
I probably think you should get tested for HIV because you have a risk factor of multiple sexual partners. So I recommend you to get tested for HIV. I can order you a test for that. Okay.
Okay.
And regarding the drinking alcohol, please, I would recommend you to quit drinking alcohol because it may cause several medical problems.
Okay.
If you wish to quit, please let us know. We have several programs to help you. Okay.
Okay.
Okay. So based on the information you have given me, you said you have pain in your right knee since 2 months and it's getting worse since 4 days, and it's aching kind of pain, and you
Yeah.
also had trauma recently,
Yeah.
4 days back. Okay. So based on this information, may I do the physical examination on you?
Sure.
Thank you. Please allow me to wash my hands.
Okay.
Do you have any questions or concerns for me?
No.
Could you please lie down for me?
Yeah, sure.
Can I lift up your tray, please? I would like to examine your knee, okay?
Sure.
Okay. Can I touch your knee?
Sure.
Okay, first I would like to examine your normal knee, okay?
Okay.
First I would like to look at it to look for any abnormalities, there's any redness, swelling which I don't find. Now can I touch your knee, please?
Sure.
Do you have any pain, discomfort here?
No. Yeah. I've noticed a little redness on my right knee, but
Okay. Okay, and may I touch your right knee?
sure.
Please let me know if you have any pain. Do you have pain?
Yeah, a little bit.
Okay, now I would like to do some tests on your knee.
Okay.
Okay. First, I would like to start with the normal knee. Can you just fold your knee, please?
Sure.
Okay. Now I would like to pull out and then push in. Okay. And I would like to do the same on this knee.
Okay.
Can I do that?
Sure.
Okay. Can you please fold your knee?
Sure.
I'd like to pull out and then push in. Now I would like to check for the sensation. Okay.
Okay.
I would like to let you know that this is sharp
Okay.
and this is dull. Okay. Please let me know what you feel. Okay.
Okay. Sharp, dull, sharp, dull, sharp, dull, sharp.
There are 5 minutes remaining in this patient encounter.
Now I would like, you must set that now.
Okay. Thanks.
Now I would like to check for the reflexes.
Oh, sorry.
No, it's okay. Okay. Sorry if I'm hurting you.
That's okay.
Okay, now I would like to strike this sharp thing.
Okay.
I'll do it lightly, move it out of the way. It might cause you some discomfort. Please
Okay.
bear with me, okay? Now I would like to check for the muscle strength in the limbs, okay?
Okay.
Can you please lift up your legs against my hands?
Sure.
Can you kick up against my hands?
Sure.
Can you kick in against my hands?
Sure.
Can you fold your legs, feet against my hands? Okay. Thank you. And now I would like to check for the movements. Can you please fold do it this way? Is it the other movement? Are you able to do it or is it restricting you?
I feel like I can do it okay.
Okay.
Yeah.
Are you able to walk well with the pain?
Yeah, I walk okay, yeah.
It's not restricting any of your activities?
Yeah, well, when I try to, like, run real hard and things like that, it
But you're able to walk?
Yeah, I can walk okay.
Could you please step down and walk a few steps?
Yeah, sure.
Okay, hold this way.
Thanks.
Okay. I would like to examine for the other joints in the hands or just quickly, okay? Yeah, the fingers, okay. I would like to examine your skin to find any rashes. Okay. So thank you for letting me do the physical examination, okay, Mr. Thompson. Based on the information you have given me and the physical examination findings, the reason for your knee pain could be due to the trauma you had recently or since you are running a lot, and it could also be due to your sexually transmitted disease which you had, gonorrhea. In some sexually transmitted diseases like gonorrhea can go into the knee and cause knee pain. So I would like to aspirate some fluid from your knee and do the examination on it, and also do some blood tests, and as well as do a pelvic examination, genitourinary examination for you,
Okay.
and get some specimens so that I can do some tests, okay?
Okay.
And once I get back the test results, I'll be able to make an accurate diagnosis and give you the appropriate treatment.
Okay.
And relating to your sexual activity, please, you should use condoms each time you have sex. It will
Okay.
prevent you from several sexually transmitted diseases, including AIDS.
Okay.
Alright. Did you understand what I said?
Yes, ma'am.
Okay. Do you have any questions about this?
No, I don't think so.
Okay. It was nice meeting
Alright,
you.
thank you. Nice
Thank you
meeting
for
you
your
too.
cooperation. Have a good day.
Thanks, you too.